today?
I'm good. How are you?
I'm Jenna. I'm gonna be your nurse. Are you here to get a physical today?
Yes, ma'am. I just needed a physical for my insurance.
Okay. Any general complaints going on today that we need to focus on?
No, ma'am.
Okay. All right. So we're gonna get started. Do you have any cultural preferences? Any religious preferences?
No, ma'am.
Okay. So what we're going to do is we're going to do a systematic approach from head to toe. We'll test things like your neurological function, your vision, motor function, range of motion in your arms and legs. Make sure your heart sounds good, your lungs sounds good, and things like that, okay?
Okay.
So I'm going to wash my hands and put my gloves on and we'll get started.
Okay.
All right? So I wash my hands and I put my gloves on. Okay? Can you tell me your name and date of birth?
Danielle Watson, 5491.
Okay. All right. Do you have any allergies or anything?
No, ma'am.
Any past medical history?
No, ma'am.
Okay, so no high blood pressure, high cholesterol, anything like that?
No, ma'am. Not that I'm aware of.
Okay. I'm just going to feel your skin.
Okay.
Check your skin turgor. Skin turgor is important, especially it can tell if you're dehydrated or anything like that, okay? Looks good. Her skin is taut. Alright, warm and dry. Okay. No wounds or lesions or anything?
No, ma'am.
Okay. Alright. So what I'm going to do is I'm going to look in your scalp. Any loss of hair recently or anything like that? Any lesions in your head?
No, ma'am.
Okay. I'm going to look in your scalp and look at your hair.
Okay.
And then we'll move to your face.
Okay.
Okay. Alright. Looks good. Alright, so what I'm going to do is I'm going to palpate your sinuses.
Okay.
See if there's any pain. Do you have sinus infections a lot or anything?
No, ma'am.
Okay. I'm also going to palpate your temporomandibular joint and you'll open and close your mouth for me, okay?
Okay.
Alright, I'm going to palpate your sinuses. Any pain?
No.
Any pain up here?
No, ma'am.
Alright. Alright, I want you to open and close your mouth.
Okay.
Alright, looks good. Alright, so what we're going to do is we're going to test cranial nerve number 7.
Okay.
That allows you to smile and like puff out your cheeks and it tests facial symmetry.
Okay.
Okay. So I want you to smile for me with your teeth.
Oh.
Okay. And puff out your cheeks like this. Okay. That looks good. Alright. So next we're going to move to her eyes. First, what I'm going to have you do is we're going to test your visual acuity.
Okay.
That also tests cranial nerve number 2. It allows us to determine if you have 20/20 vision or if you're having trouble seeing. Do you wear contacts or glasses?
No, ma'am.
Okay. So what I'm going to have you do, I'm going to have you look at this board, the visual acuity chart, and I'm going to have you cover one eye,
Okay.
and I want you to read the first 4 letters for me.
F-A-L-L.
Okay. All right. Go to the other letters for me.
Okay. F-A-L-L.
Okay. All right. Any blurry vision or anything like that?
No, ma'am.
Okay. No no, you don't see anything in your far vision or anything.
No, ma'am.
All right. Sounds good. It looks like you do have 20/20 vision. All right. Any pain in your eyes at all?
No, ma'am.
Okay. All right. So next, I'm gonna shine this pin light in your eyes.
Okay.
That tests to see if your eyes are reactive to light. And that also tests cranial nerve number 3 and 4. That's when you are able to test the extraocular muscles, allowing you to look to the left and right and up and down, okay?
Okay.
And in and out, all right? So I want you to look straight at me.
Okay.
All right, I'm gonna bring this in from the side. All right, her pupils are round and reactive. The size is about a 3. All right, I'm gonna have you look up, look down, look to the side, look this way. All right, now we're gonna test cranial nerve number 6. That's the cardinal gazes. I'm gonna go in a pattern, a diagonal pattern, and I want you to follow me, okay?
Okay.
All right, that looks good. Her eyes are round and reactive to light and equal and symmetric, okay?
Okay.
So all that checks out really good.
Okay.
Next, I'm gonna look in your ears.
Okay.
Any pain or difficulty hearing?
No, ma'am.
Never had to wear hearing aids or anything like that?
No, ma'am.
No ringing in your ears?
Mm-mm.
Okay. Any tenderness, drainage?
No, ma'am.
Do you have a problem with wax?
I have a little bit of wax, but nothing unusual.
Okay. So what I'm going to do is I'm going to press on your ear.
Okay.
Does that hurt?
No.
All right. I'm just going to take a look. All right. So we're going to test cranial nerve number 8. That is allowing you to hear.
Okay.
So what I'm going to do is I'm going to whisper in your ear, and I want you to repeat the word after me.
Okay.
Okay?
Pink.
Okay, let's test this side.
Pink.
All right, sounds good. So next, I'm going to look at your nose. Any problems with drainage or congestion or anything?
No, ma'am. Just seasonal, stuff, but nothing unusual.
Ever had any trauma to your nose?
No, ma'am.
Okay. No broken nose or anything like that?
No.
Okay. So what I'm going to do is I'm going to have you smell something. That says cranial nerve number 1 is the olfactory nerve. It allows us to smell.
Okay.
So what I'm going to do is I'm going to have you smell a candle,
Okay.
and you tell me if you're able to smell it, okay?
Okay. Yes, ma'am. Smells like pine.
Sounds good. Alright, what I'm going to do is I'm going to assess the patency of your nose. I'm going to hold pressure on one side, and you're going to sniff, and I'm going to do both sides.
Okay.
Alright, sounds good.
Okay.
Alright, and I'm just going to take a look up there, make sure everything checks out good.
Okay.
Any nosebleeds or anything?
No, ma'am.
Okay, sounds good. Alright, next we're going to move on to your mouth and your throat.
Okay.
The important thing is that we have a gag reflex. That's part of cranial nerve number 9 and 10.
Okay.
So what I'm going to do, I'm going to put a tongue depressor in your mouth,
Okay.
and I want you to say ah for me, and we'll test your gag reflex, okay?
All right.
Alright? Alright, say ah for me. Alright, say. I'm just going to take a look. Okay. Alright, I'm going to take a look with my light. Do you have your you do have your tonsils?
Yes, ma'am.
Alright, your tonsils look good. No redness or anything. Do you usually have sore throat?
No, ma'am.
Okay. What I want you to do, I want you to stick your tongue out. I want to be able to see if you can move your tongue side to side. And that says cranial nerve number 12. Okay. So stick it out for me. Okay. That looks good. Alright. Any problems with dry lips or anything?
No, ma'am.
Any lesions on your lips?
No, ma'am.
Okay. What about, and you say you don't have sore throat?
Mm-mm.
Okay. Any dryness in your throat?
No, ma'am. No,
Okay.
no pain or anything.
Alright, so next I'm gonna assess your neck.
Okay.
Do you have any problems with swollen lymph nodes?
No, ma'am.
Okay. Alright, and also I'm gonna test your thyroid gland. That I have to get you to drink something, and when I feel you swallow,
Okay.
okay? So I'm gonna grab your water. Is water fine?
Yep, that's fine.
Okay. Alright. Okay. I got your water.
Okay.
So first I'm just gonna palpate your neck to make sure I don't feel any swelling in your lymph nodes, and it'll be all around your neck, okay?
Okay.
Alright, Tell me if you feel any pain or tenderness at any point in time.
Okay.
Any pain?
Mm-mm.
Okay. Alright, so what I'm going to have you do is I'm going to have you go ahead and drink this water. I'm going to feel your thyroid as you swallow. When I tell you to swallow, swallow.
Okay.
Ready? Swallow. Okay.
Mm-hmm.
Okay. That looks good. Alright, so I'm going to have you go ahead and lay this way.
Okay.
We're going to test your carotid pulses to make sure they sound good and feel good, okay?
Okay.
I'm going to check one side at a time because if you do check both sides at a time, it could cause them to vagal down and pass out.
Mm-hmm.
Turn your head this way for me. Okay, turn your head that way. Alright. Alright, you can go ahead and sit up for me.
Okay.
Also, when she was laying down, I did not notice any jugular vein distension. So her jugular veins were normal. Okay? So next, we're gonna move to your lungs and your chest to make sure your breath sound good. I don't hear any crackles, wheezing, or anything like that. Make sure your chest is symmetrical. I'm also gonna feel in the front and in the back.
Okay.
Okay, so anterior and posterior.
Okay.
Yep, go ahead and sit up for me. Alright. Any problems with breathing?
No, ma'am.
Shortness of breath?
Mm-mm.
Anything like that? You never had a pneumothorax or anything?
Mm-mm.
Alright, so I'm going to come behind you and I'm going to feel this test for tactile dermatitis, and I want you to say 99 when I tell you to, okay?
Okay.
Turn to the side. Can you turn to the side for me?
Mm-hmm.
Like this? Yep. Alright, say 99 for me.
99.
Say 99.
99.
Alright. I'm gonna tell you to breathe in and breathe out, okay?
Okay.
Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Alright, I'm just gonna percuss over your lung fields, okay?
Okay.
Alright. I'm gonna take a listen to you while you're turned around.
Okay.
Breathe in. Sounds good. Alright, is it okay for me to lift up your shirt just to take a look?
Yes, ma'am.
Okay. Breathe in. Breathe in one time. Okay. Alright, I'm gonna take a listen to your anterior chest to make sure the lung sound good there, okay?
Okay.
Breathe in. Okay. So that sounds good. While I'm up here, I'm gonna take a listen to your heart. Okay.
Okay.
You've never had any heart murmur or anything.
No, ma'am.
Your heart doesn't skip a beat.
Mm-mm.
Okay. All right. So what I want to hear is normal heart sounds, which is S1, S2. If you've ever heard your heartbeat, it sounds like love dub.
Mm-hmm.
So that's what I'm looking for. We want to rule out any murmurs or extra heart sounds or anything like that. Okay.
Okay.
Your lungs did sound good. They're clear bilaterally. Negative for any wheezing or anything like that, crackles or anything.
Okay.
Okay. And first, I'm going to count your heart rate
Mm-hmm.
by listening to your apical pulse, okay?
Okay.
All right. And I'm also going to put my hand on your radial pulse to see if there's any pulse deficit.
Okay.
All right. Her heart rate was about 71 and she did not have a pulse deficit. So now what we're going to do is we're going to move on to looking at her abdomen. Any problems with constipation or anything?
No, ma'am.
Okay. Ever had like any gastrointestinal issues?
Mm-mm. No,
Okay.
ma'am.
Alright, and what I'm also going to do is I'm going to palpate your liver just to make sure it's not enlarged or anything like that.
Okay.
And I'm going to listen to your bowel sounds. So I'm going to have you lay back for me.
Okay.
Yeah, that's fine. Okay. I'm gonna pull your shirt up. Is that okay? Just
That's fine.
pull it. Okay.
Yep.
Alright. Her abdomen is symmetrical.
Mm-hmm.
Alright. So what I'm gonna do is I'm gonna listen first, then I'll palpate.
Okay.
Okay. Her bowel sounds are active in all four quadrants, so that's good, okay?
Okay.
That indicates that you don't have any indication of a bowel obstruction or anything like that.
Okay.
Alright, so what I'm going to do is I'm going to palpate your abdomen with light touch and deep touch, okay?
Okay.
Alright? Any pain?
Mm-mm.
Any pain out there?
Mm-mm. No, ma'am.
Any pain?
No.
Any pain?
No, ma'am.
Okay. No tenderness?
Mm-mm.
Good. Alright. So, what we're going to do next is I'm going to palpate your liver. It is on the right side.
Okay.
So, I just want to make sure it's not enlarged or anything. I'm going to tap on it.
Okay.
Alright. Any pain?
No, ma'am.
Okay. Alright. No pain with that?
No.
Alright. So, what I'm going to have you do is stand up.
Okay.
So, what we're doing now is we're going to test your range of motion in your upper extremities and your lower extremities, okay?
Mm-hmm.
So, what I'm going to have you do is I'm going to have you lift your hands out like this.
Okay.
Alright, I'm going to have you lift your hands out like to your side.
Okay.
Alright, and then lift your shoulders up. Any pain or anything, any tightness?
No, ma'am.
Okay, alright. What I'm going to have you do is I'm going to put your hands out on mine.
Okay.
I'm going to push up and you push against me, okay?
Okay.
Okay? No weakness or anything like that?
No, ma'am.
Alright. Alright, let's go ahead and test your lower extremities.
Okay.
You can go ahead and have a seat.
Okay.
So pick one leg up for me.
Okay.
Pick the other leg up for me.
Okay.
Okay? What I'm going to have you do is push against my hands to measure resistance, okay?
Okay.
Alright, good. Are you able to push your feet back?
Yes, ma'am.
Go up and down for me.
Okay.
Alright? I'm going to feel your pulses on your brachial artery and your radial artery, okay?
Okay.
It's full and bounded. Strong, full, and bounded. Okay, let's do this side. Just relax that hand for me. Same thing with that side, strong, full, and bounded.
Okay.
Alright. What I'm going to do is I'm going to test your posterior pulse, your dorsalis pedis pulse as
Okay.
well. Never had any blood clots or anything?
No, ma'am.
Full and bounded. Let's test this one. Okay. Good, good. All right, let's test your pulses behind your knee.
Okay.
Good, full and bounded and strong. It seems like you're really healthy.
Yes, ma'am.
Do you exercise at home?
I do.
What kind of diet do you have? Do you eat a lot of fast food?
No, ma'am. I do eat fast food, but I try not to do that, too excessive.
Okay. All right. So what I'm going to do is I'm going to assess your cat refill. That just if it blanches, that indicates that you do have a good cat refill and your circulation is good.
Okay.
Good. Her cat refill is less than 3 seconds. I'm going to do your foot too. Okay. Yep. Less than 3 seconds. All right. That's good. All right. So now what I'm going to do is I want to see you walk, okay? Just to make sure your gait is good.
Okay.
All right. So I want you to walk towards the door for me.
Okay.
Okay. No problem?
No problem.
All right. No dizziness or anything?
No, ma'am.
All right. So I'm going to have you stand up.
Mhm.
What we're going to do is we're going to do the Romberg test. That tests neurofunction.
Mhm.
So what we're going to do is I'm going to have you keep your feet together.
Okay.
I'm going to have you put your hands out like this. And I'm going to count 30 seconds. First, I just want you to keep your eyes open and then we'll close our eyes, okay? I want to see if you have any excessive swaying or anything or loss of balance, okay? So I'm going to count the 30 seconds.
Okay.
All right, so now I want you to keep your arms out and I want you to close your eyes.
Okay.
For 30 seconds. Keep closing your eyes for me.
Okay.
All right, good. It is negative, so that is a good sign that you do have great neurological functioning.
Okay.
So what I'm going to do, this is also a part of the neuro test. I'm going to have you, I'm going to press with a sharp object and also a light touch to see if you react to the pain, okay?
Okay.
So you can go ahead and have a seat for me. I'm going to get my tools, okay?
Okay.
Alright, so first I'm going to do the light touch.
Okay.
Alright, and you tell me what you feel.
Okay.
Alright?
I feel that.
Okay.
I feel that.
Feel that?
Mhm.
Alright. Feel that?
Mhm.
Light touch?
Yep.
Okay. Alright. Any pain?
No, ma'am.
Alright, so this is going to be pain, okay?
Okay.
Alright. Feel pain?
Yes.
Okay. Okay. Alright. So the last part of the exam, I want to examine your spine to make sure you don't have any musculoskeletal issues. Do you have any spine issues?
I do have scoliosis.
Okay, alright. So what I'm going to do, I'm going to have you stand up.
Okay.
Alright, I'm going to pull your shirt up so I can look at your spine. Is that okay?
Yes.
Alright, so turn to the side for me. I'm going to lift this up and I'm going to feel each vertebra, okay?
Okay.
I'm going to have you touch your toes for me so I can examine your spine.
Okay.
Any pain with that?
No, ma'am.
Alright, stand up for me. Looks good. I do see the scoliosis. Do you go to a chiropractor for that?
No, ma'am. I just see my regular doctor.
Okay. So what I'm going to have you do is I'm going to have you twist. I don't want you to bend over.
Okay.
I just want you to twist your upper torso like this.
Okay.
Alright, just twist to this side. Alright, now twist to the other side. Alright, I want you to bend this way for me.
Okay.
Just with your spine. Yep. There you go. Bend to this side. Good. Good. Alright.
All right.
You can have a seat for me.
Okay.
So, everything looks good. You don't have any issues going on right now that I see.
Okay.
The provider will follow up with me.
Okay.
Do you need anything else checked?
No, ma'am.
Okay. All right. Well, you are in good health. If you need us, definitely come back.
Okay.
If you're having any problems, just call us and we'll get an appointment for you, okay?
All right.
Thank you for your time, and we'll get your paperwork together and get your physical form filled out, okay?
All right.
All right. Thank you. Have a good day.
You too.